Our next section in microbiology is the systems section, in which we'll mostly be synthesizing and reviewing information we've already covered. We'll start with looking at the normal flora. Staph epidermidis is normal flora of the skin as well as the nose. The nose also contains Staph aureus. The oropharynx contains viridans strep, and dental plaque often contains strep mutans. In the colon, Bacteroides fragilis and E. coli are both normal flora, although Bacteroides is more common. Lastly, in the vagina, Lactobacillus is normal flora. It can also be colonized by E. coli and group B strep. It's important to keep in mind that neonates who are delivered by C-section have no flora, but are rapidly colonized after birth. There are several bugs that can cause food poisoning. By learning which food can give you which bugs, you can more easily diagnose an organism on exam questions. Patients who get food poisoning from contaminated seafood are often infected with Vibrio parahemolyticus or Vibrio vulnificus. A patient who has eaten reheated rice may be infected by Bacillus cereus. Patients who have recently eaten meats, mayonnaise, or custard may be infected by Staph aureus. In cases of Staph aureus food poisoning, the toxin has already been pre-formed, so patients are not actually infected with an organism, but rather they are reacting to the toxin itself. Therefore, antibiotics would have no effect. Reheated meat dishes can contain Clostridium perfringens, and any time you see mention of canned foods or honey, your first thought should be C. botulinum. Undercooked meat can be responsible for E. coli O157H7 infection, which is enterohemorrhagic E. coli. And lastly, poultry, meat, or eggs can all cause salmonella. There are some bacteria that can imitate the lower right quadrant pane of appendicitis. These microbes include Salmonella typhi, Campylobacter jejuni, and Yersinia enterocolitic. Okay, now we'll talk about some bugs that can cause diarrhea. Campylobacter is a gram-negative, spiral-shaped organism, which is unique in that it grows best at 42 degrees Celsius. It is a major cause of foodborne illness and can be obtained through animal products. Can you remember which neurological disease can be caused by Campylobacter jejuni? Right, that would be Guillain-Barré syndrome. Salmonella can also cause bloody diarrhea, as can Shigella. Keep in mind that Shigella has very low ID50, which means that very few microorganisms are required to cause an infection. Enterohemorrhagic E. coli, or E. coli O157H7, also causes bloody diarrhea, and similar to Shigella, produces a Shiga-like toxin. Enteroinvasive E. coli can cause dysentery, which includes bloody diarrhea, by causing necrosis and inflammation of the colonic mucosa. Yersinia enterocolitica is a common cause of bloody diarrhea in daycare. And C. difficile, although listed under watery diarrhea, can cause both bloody or watery diarrhea, and pseudomembranous colitis as well. Our last bug that can cause bloody diarrhea is Entamoeba histolytica, which is a protozoan that can cause flask-shaped ulcers in the intestinal mucosa. The bugs at the bottom of the slide can cause watery diarrhea. These include enterotoxigenic E. coli, which causes traveler's diarrhea and produces ST and LT toxins. Vibrio cholera, which commonly causes outbreaks in third world countries and is known for causing rice water diarrhea. C. perfringens, which can also cause gas gangrene. Several protozoa, including Giardia and Cryptosporidium. And lastly, several viruses, which include rotavirus, adenovirus, and Norwalk virus. Several different microorganisms can cause pneumonia, and by knowing which ones are most likely to infect people of which age group, you can more easily figure out which bug is infecting your patient. If you see pneumonia in a neonate, it's most likely caused by group B strep or E. coli. Remember, B, as in group B strep, is for babies. Children from age 4 weeks to 18 years old are much more likely to get pneumonia from viruses such as respiratory syncytial virus, mycoplasma, chlamydia trachomatis, and strep pneumonia. As I mentioned earlier, almost all children will be infected with RSV at some point in their lives. To remember the sources of pneumonia that most commonly affect children, you can use the mnemonic: runts may cause sputum. Pneumonia in adults is often due to similar organisms as pneumonia in children, including Mycoplasma, C. pneumonia, and S. pneumoniae. The only difference really is that adults aren't likely to get it from RSV. Older adults above the age of 40 can get pneumonia from strep pneumoniae and Mycoplasma, but are now also likely to get it from H. flu, anaerobes, and viruses. Finally, in the elderly, the most common source of pneumonia are S. pneumoniae, influenza, anaerobes, H. flu, and some gram-negative rods. In addition to thinking of causes by age, we can also categorize pneumonia by how it's obtained. Hospital-acquired pneumonia is often due to Staphylococcus and enteric gram-negative rods. Pneumonia in immunocompromised individuals can be caused by staph, enteric gram-negative rods, and also fungi, viruses, and Pneumocystis jirovecii in HIV patients. Pneumonia caused by aspiration is often due to anaerobes such as Klebsiella, S. pneumoniae, and Staphylococcus. Patients with cystic fibrosis are most likely to get pneumonia from Pseudomonas. Patients with recent viral infections can often get pneumonia from Staphylococcus or H. flu. Lastly, Mycoplasma, Legionella, and Chlamydia can all cause atypical pneumonia, which is also known as walking pneumonia. It is a type of pneumonia in which chest X-ray will often be positive before symptoms even start to occur. Now I'll break down age groups that are common for meningitis in a similar way as we did for pneumonia. In newborns, meningitis is often caused by group B strep, E. coli, and Listeria. Again, it is helpful to remember that the B is for babies. Children below the age of 6 years are most likely to get meningitis from strep pneumoniae, Neisseria meningitidis, Haemophilus influenza type B, and enteroviruses. However, enterovirus is an extremely rare cause of meningitis, and H. flu type B is also now very rare due to immunization. Meningitis in older children and adults is most likely caused by strep pneumoniae, Neisseria meningitidis, enteroviruses, and HSV. Neisseria is the most common in high school-aged people, while strep pneumo is much more common in people aged greater than 40 years. Lastly, in patients over the age of 60, strep pneumonia is the most common, but now we also have gram-negative rods and Listeria. The viruses that can cause meningitis include enteroviruses, especially Coxsackie virus, herpes simplex virus, HIV, West Nile, and varicella zoster virus. Patients with HIV can also have cryptococcus, cytomegalovirus, toxoplasmosis, or JC virus infections. This chart indicates the effect of meningitis on several lab values and the differences seen in meningitis caused by bacteria, fungi, and viruses. CSF pressure increases in meningitis caused by bacteria and fungi, and sometimes even in meningitis caused by viruses. To remember this, just think that the bacteria and fungi are taking up more space, putting more pressure on the volume of cerebrospinal fluid. Viruses are much smaller and take up less space, so sometimes they don't change the pressure at all. In bacterial meningitis, you'll see an increase in polymorphonucleosides, or neutrophils. This is because neutrophils are the main cell type involved in killing bacteria. On the other hand, in fungal and viral meningitis, you'll see an increase in lymphocytes because these are the main cell type involved in killing these types of infections. Protein levels will increase in both bacterial and fungal meningitis and can either increase or stay the same in viral meningitis. You can remember this by thinking that bacteria and fungi have a lot of protein, and therefore if they're in the CSF, there will be more protein in the CSF also. Sugar is the opposite and is decreased in both bacteria and fungal infections. To remember this, just think that the bacteria and fungi are actually consuming all of the sugar, whereas the viruses don't consume sugar at all. Osteomyelitis is another disease that can be caused by several different pathogens. In most people, unless you have reason to believe otherwise, the most common cause of osteomyelitis is Staph aureus. However, in several other types of patients, other organisms can be more common. In sexually active individuals, Neisseria gonorrhea can cause osteomyelitis. However, this is rare. It's more likely to cause septic arthritis. Diabetics and drug addicts can both get osteomyelitis from Pseudomonas. Patients with sickle cell will get osteomyelitis from Salmonella, and patients with prosthetic replacements can get osteomyelitis from Staph aureus or Staph epidermidis. Osteomyelitis of the vertebra can be caused by Mycobacterium tuberculosis, in which case it can be called Pott's disease. Lastly, cat or dog bites or scratches can carry Pasteurella multicida, which can cause osteomyelitis. Most of the time you'll see this disease in children. An elevated CRP and ESR are classic but nonspecific. By definition, UTIs or urinary tract infections are caused by bacteria. On the next slide, we'll talk about which bacteria can cause UTIs, but first let's talk more about what it is. Patients with UTI often present with dysuria, urinary frequency, urgency, suprapubic pain, and white blood cells in the urine, but not white blood cell cast. The most common pathway for infection is by ascension of microbes from the urethra to the bladder, and therefore UTI is much more common in individuals in whom it's easier for the pathogen to get from the bladder to the urethra. So, for example, in males, UTIs can be more common in patients with congenital defects or vesicoureteral reflux. It's also more common in women because they have shorter urethras, which can also become colonized by fecal flora. Some other predisposing factors include obstruction, kidney surgery, catheterization, GU malformations, diabetes, and pregnancy. If UTIs ascend even further, they can ascend to the kidneys, which may result in pyelonephritis. This can present with fevers, chills, flank pain, CVA tenderness, hematuria, and white blood cell cast in the urine. To diagnose UTIs, you use the leukocyte esterase test first, which tests for any type of bacteria, or the nitrite test, which is more specific for gram-negative bacterial UTIs. As promised, here are the bugs most likely to cause UTIs. E. coli is the leading cause of UTIs, followed by Staphylococcus saprophyticus, which is most often seen in sexually active women. In third place is Klebsiella pneumoniae, Serratia marcescens, Enterobacter, Proteus, and Pseudomonas. Sometimes knowing the patient's history can help you narrow down what kind of UTI bug they have. For example, Serratia, Enterobacter, and Pseudomonas are all commonly nosocomial, so a patient who has recently been in the hospital and now has a UTI is likely to have one of these. Likewise, a patient with struvite stones who also has a UTI is likely to be infected with Proteus. The torches infections have been mentioned several times throughout this chapter, so now let's go over them in more depth. Basically, the torches infections are a collection of pathogens that can cause congenital defects when passed from a mother to a developing fetus. The reason they're called torches infection is because that's the mnemonic that's used to remember them. Toxoplasma gondii, rubella, CMV, HIV, herpes simplex virus, and syphilis spell torches. Some runners up to this list include Strep agalactiae, E. coli, and Listeria monocytogenes, all of which can cause meningitis in neonates. However, this is not a congenital defect, and therefore they don't quite fit into the torches category. Toxoplasma gondii is most commonly acquired from cat feces and is usually asymptomatic. However, when passed from mother to neonate, it can cause a classic triad of symptoms: chorioretinitis, hydrocephalus, and intracranial calcifications. Toxoplasmosis can also cause brain lesions in patients infected with HIV. Rubella is often acquired through respiratory droplets and can cause rash, lymphadenopathy, and arthritis in infected individuals. When it is passed from mother to a fetus, it can cause patent ductus arteriosus, cataracts, deafness, and a blueberry muffin rash. Cytomegalovirus is a very common pathogen, and it's likely that most people have it. It can be acquired through sexual contact and organ transplants. It's almost always asymptomatic and only really causes problems in patients who are immunocompromised, such as those with HIV, or when passed from a mother to a fetus, in which case it can cause hearing loss, seizures, and a petechial blueberry muffin rash that is similar to rubella. HIV is obviously a sexually transmitted disease. We've already discussed how it can have a variable presentation depending on CD4 count. When it's passed from mother to fetus, it can cause recurrent infections and chronic diarrhea. The herpes simplex virus can be acquired through skin or mucous membrane contact. It is usually asymptomatic, but it can cause hepatic or vesicular lesions. Its effects on neonates who acquire it from their mothers are much more serious. In addition to herpetic lesions, these infants may also have temporal encephalitis. Lastly, syphilis is also a sexually transmitted disease. As we discussed earlier, primary syphilis can cause cankers, secondary syphilis can cause disseminated rash, and tertiary syphilis can cause cardiac or neurologic disease. When passed to a fetus, it is often deadly and results in stillbirth due to hydrops fetalis. If the child survives, he or she can present with many facial abnormalities, such as notched teeth, saddle nose, and short maxilla, cranial nerve 8 deafness, and saber shins, which is a sharp anterior bowing of the tibia.